So the next way that we see digital health companies go to market is through what we're calling physician administered. And it's one of the broader, more interesting, and I think bigger categories, at least recently. But Brian, do you want to define what we mean by that and maybe an example there?
Sure. It's when a physician buys a device and then dispenses it or prescribes it to a patient. Here's where we see digital diagnostics and those types of items where they might be undertaking remote therapeutic management or remote physiological management, RPM and RTM. Then what they do is they bill for their services based on the prescription, and then the patient has the product, and there may be a subscription to it, or there may be other ways of payment to it. It's where the physician is administering the product and is following the patient through the use of that product and billing.
I like to think of this model as the digital health company is essentially a technology company, often selling something as a SaaS model or maybe a license to a physician who then is using the product to deliver some service that they can bill for. And often
Right.
those services, if you think about the RTM coding or diagnostic coding, requires the use of some tool, but it doesn't necessarily require the use of that specific tool. And so, interestingly, the commercial model, as I understand it, for the digital health company, looks like any other enterprise go to market, and it's the healthcare provider then to package it up in some way that they can bill a particular claim. Now, some of the tools go further and actually get involved in the billing, so that's another implication. Anything else
Right.
you think that companies thinking about this model need to be aware of?
Yeah, so instead of selling through suppliers, they would be selling to the providers. They would be selling to basically those who are prescribing and helping them understand what it means to be billing for the use of the product.
And we've seen, as we've worked with companies, whether it's digital diagnostic or RTM, one of the things I have to be concerned about is what does it take for the provider practice to actually be able to bill the code that embeds their technology and get reimbursed for it. So we do see a lot of the digital health vendors thinking about the reimbursement to the provider, even though they're not actually the provider. And at the end of the day, there's a subscription. But you can imagine that if they're charging something for their service and the physician isn't able to recoup the billing, then the cash flow doesn't work for the physician
Right.
practice as well.
Exactly. Exactly.
Um,